mean, people get degrees in this: music therapy, art therapy, drama therapy. And then there are people like Adam Driver, who was in the Marines and played one of the lead roles in Star Wars. But for the Marines, he would just get them doing plays, not plays that came from them, but just that learning to step inside someone else's body, someone else's world. And their PTSD symptoms started disappearing.
In this episode of Doctors in Dialogue, we will be exploring what happens when the arts are brought back into the heart of therapy, particularly in places where trauma is deep, resources are limited, and voices have long gone unheard. For centuries, art has been part of how humans make sense of suffering and loss. Yet in modern medicine, creativity has often been seen as optional, something separate from real clinical work. Today, I will be joined by two longtime members of the Group for the Advancement of Psychiatry, Drs. Kenneth J. Weiss and Donald C. Fidler. Dr. Weiss is a forensic psychiatrist and professor at the University of Pennsylvania. Dr. Fidler is a psychiatrist, educator, and playwright who has spent decades blending cultural psychiatry with the arts in communities around the world. When people hear the term arts in therapy, it can sound a little bit of an abstract or even mysterious. By the end of this conversation, what do you hope our listeners will understand about it that they don't understand right now?
I'm hoping that people realize that the different arts, like my focus was theater, but whether it's painting, I've worked with art therapists, music therapists, that any of the arts can be used in therapeutic ways. And not only with individuals, but with families and with entire communities.
But over the years, you have been a psychiatrist, a teacher and mentor, an actor, a playwright, a set designer, a video producer. So how did all of these get layered and how did it play out for you?
So my grandfather built the first movie theater in the mountains of North Carolina. I had very poor vision and I could see what was on the big screen. So I could see people's emotions and expressions. And I was missing that in everyday life. And I would feel like these people on the screen care for me. They're having an impact on me and they're reacting to me and I'm getting to see them react. And then my grandparents also helped build an outdoor theater, and people would come up to me afterwards talking about what impact it had on them.
Don, when did you first think about integrating this into your work in psychiatry?
I would write little plays for the little kids in the neighborhood growing up. And whether they were football players or whatever, they loved being in them, using our imagination together. So I started doing that during med school, writing plays for us to do as med students. And then as residents, writing that to make videos of the different residents and nurses and everybody playing parts of patients to show disorders and therapeutic techniques. And I remember some patients saw those, and the patients started talking about how therapeutic it was for them to see those videos. Like we just did one on emotions, and I had people play 11 or 12 different emotions, label them. So we had a mime do them, somebody speak a little bit about it, and someone acted. And a patient who had dissociative identity disorder got a hold of it some way. I still don't know how. And they were talking about how it helped her because she could connect each of her different personalities to a different emotion in that video. And it helped her to keep watching that and realize she was splitting among emotions.
Don, is there a particular branch of the arts that you've used more in your treatment with patients than others? You mentioned that you were a playwright.
So when I first joined GAP, I was on the therapeutic committee and found out they were going to Alaska to consult in the 200 plus villages up there about problems with alcohol and suicide and depression. And visiting the villages, they were very shy of physicians coming in, psychologists and psychiatrists coming in, but they would play. And first thing I knew, starting with the children who were the least shy. We would do little games and acting and playing. It was interesting. They didn't have a concept of pretending. So when we would do a little fight or something, like a little stick fight, they were actually hitting one another's hands. And we were trying to say, no, it's pretend. And once they learned that, they just became total hams. And then that spread to involving the adults.
Don, it's interesting to hear your manifest mission was to help them with a self identified problem of alcohol use disorder. And I wondered whether you got beneath that and looked at some of the underlying problems that perhaps were responsible for the alcohol use.
That was absolutely key. In talking to everyone there, I was learning their history. And I was like, no wonder people abused alcohol and were suicidal and all. Dominant cultures, starting with the Russians, had first moved into Alaska, and then the United States. And both dominant cultures stole away their languages, gave them new names, stole away their music, the types of foods they often ate, just stealing away traditions, and then started shipping children off to church camps down in the lower contiguous 48, and they were often sexually abused and then returned back there. Plus, they were having natural disasters with tsunamis and volcanoes, and they were eager to talk about all of this, not so much the sexual abuse that came much later. And they would tell stories, and I would video them, like stories about if they spoke in their own language. In school, the teachers would wash their mouths out with soap, make them stand in a corner and shame them and call them heathens. One woman I talked to had married a Filipino fisherman that happened to pass through the village and stayed there. And she married him, she said, at first because he was not a heathen, where the villagers were called heathens, and she wanted her children to only be half heathens. And so we started doing plays about all of these things, starting with the children at first in summer camps that we arranged. So I started taking med students and residents with me up there to get elective credit, and we would set up doing plays about all of this. And people started drinking less, less violent crimes, started going away to go to college, and all kinds of wonderful things.
When you said they were starting to act out plays to deal with the trauma, can you describe one of those circumstances when you did that? Like what play did you use and how did that help?
Well, we would collect stories from the children and adults and try to work with them to write a play, and then they would perform it at the end of the 2-week camp. So, like we had simple things like when they were hunting otters. So we had some children lie on the ground and pretend they were the sides of a boat. Then we had other children sitting inside that boat pretending they had spears. Then we had others lying on their back acting like otters, eating the clams and all. We would have an earthquake and they would all be standing and falling down during the earthquake. So the only thing we didn't portray was the sexual abuse. And then that was just told in a very few words. And a lot of the elders were very worried about the children learning about that. But when they saw the children accepting it and doing it in a playful way, they said, this is what we needed for healing, where it's out there for all of us to talk about.
That's amazing that they accepted you as a therapist in the sense avoiding participant observation effects.
One time, a physician and a dentist came and they stayed in a little clinic there. And Linda, one of the matriarchs of the village, said, all these doctors and people who come in here to help us, they won't join in anything we're doing. All of these doctors are just standoffish and distant and cold, and they're never friendly or something. And I looked at her and I said, well, you remember I'm a physician, right? And she went, because you're family, you don't count. So is that thing of the other consultants from Gap were just going to villages for 2 or 3 days and then go to another village and another. And at the very beginning, I said, no, I want to stick with one village where I can become a member of that village. And they made me an honorary member of the village and an honorary member of the tribe. But I went back for about a month every year for 30 years. So it was this thing of really, really being part of them.
One thing that's clear then, Don, is that drive-by clinics do not work.
No. And I just felt that from early on. I mean, but well, I was raised in Chapel Hill there where there was a psychoanalytic department, and we knew about sticking a long time with patients and being like a member of their family in their stories and brains.
Does your experience inform you in any way of how you take a history from a patient? I mean, when I do a history of a patient, even if in a forensic setting, I'll ask them about early childhood adverse experiences and traumas and so forth. But it sounds like there are deeper layers and that people don't always want to talk about them. So I'm just wondering whether the things you've learned might also be useful for practitioners generally in being respectful of what the former generations of the patient who comes into the office have experienced over time.
We made videos of all of this. And then I also went to the South Island of New Zealand to work with Maori and the outback of Australia, working with Aborigine tribes, and then a Omani tribe up in the mountains in the Persian Gulf area, and became members of those tribes. And and for some of them, like in Australia, I would just visit some different villages for the 2 or 3 day period. So I'm like, what can I do? So I showed them videos of what we had done in Alaska. I had permission from the village up there. I would show them, and they would start crying and feel very involved, and go, that's the same story as us, those poor people. And then they would open up and talk about themselves. So I try to use an abbreviated. So using that as a cue, uh, I think almost like a Rorschach of showing and getting people to talk about offering some stimulus to them, not just questions that are head on, but indirectly getting to that. I think it feels less toxic to people.
Book groups and movie groups are still very popular, maybe more
Oh,
popular
yeah.
than ever. And I wonder if, without throwing the participants into acting things out, somehow it universalizes emotions and experiences in a way that becomes generically therapeutic.
I hear all the time young people talking about lyrics of some of whether it's rap or uh, punk rock or Taylor Swift or anybody's lyrics of what it means to them and what it made them think of. So I think using the arts to stimulate, because people worked hard digging in themselves to create these art forms, and then they resonate and will get people to talk rather than a head-on approach. Like, were you sexually abused as a child or what age? No, that's a turnoff.
You learn
This is
how to stimulate people to clam up, and you don't want to do that
yes,
for sure.
yes. I don't know why that patient didn't cooperate.
Right.
Don, are you familiar with the use of other art forms like painting or writing as ways to get to people besides acting?
It was interesting. We had a patient in Chapel Hill who was an artist and had pretty severe symptoms of schizophrenia. And his works were wonderful. They got displayed in museums in the Chapel Hill area. So he could not stand seeing a therapist head on. It would be too intense. So we would assign him students to see him. and he would talk about his paintings and all with them. And then they were only going to be there 8 weeks for their rotation, but his art just opened up whole worlds of things he couldn't talk about directly, but he could with his painting. And then in describing them, he was indirectly talking about what was significant in his life.
How would you recommend that current physicians, particularly, incorporate artwork into their treatment of patients?
I mean, people get degrees in this: music therapy, art therapy, drama therapy. It's a matter of us welcoming them into our hospitals and clinics. Of course, with insurance and all of those kinds of things. I mean, there were things I was doing with art, and then I was told, well, Medicare won't pay for this. We can't really afford for you to do it anymore. It's that thing of valuing it.
You mentioned that, we know you worked with residents when you took them to Alaska. If you could build one creative arts practice into standard medical training, what would it be? I mean, aside from the art therapists who are around, and I agree with you, there are many people that can do wonderful things there. But what would you do about the training process for young doctors to help them with this?
I used to run an adolescent unit, and there were some workers there, psychologists and social workers who would work with the children. One year, one of them said he wanted to have the children do Macbeth. And it was a unit where all these kids had to have 3 strikes against them. They had to be charged with a crime. They had to be abusing drugs and have some other like attention deficit disorder or some other psychiatric principal diagnosis. And they performed Macbeth. And then these kids would sit around and talk about, I never understood about why I felt like this, or my family was like, they really identified with these characters. It was incredibly therapeutic. So there are people out there aching to do this if we ask them and make time for it. I go to the movies to get therapy and to plays to get therapy. Always, it happens every time.
It's for people listening who are technically minded. Is there a difference between drama therapy and psychodrama?
Psychodrama comes from the people. So, for instance, some of the adolescents I worked with, I said, if you continue these behaviors, what will you be like when you're an elderly person? So, let me interview you as an 80-year-old. So that came from the kid. Then I said, okay, now if you changed your behaviors today, let me interview you as how you would be as a 80-year-old. And it was there. That health was there. It was, people couldn't believe what they were hearing. And so that was coming from the person. With drama therapy, you actually have a script or a play. And that, in what we did in Alaska, that was drama therapy because we wrote scripts even though it was based on them. So it did come from them, but it was a script, and they're stepping into being someone else or something else if they're a sea otter. So it's a fixed kind of way. And that's what Adam Driver did. He never had these soldiers do things about PTSD. He just had them do some famous plays. And that's drama therapy.
And you get to the same goal either way?
Yes.
Okay,
Either
very
way. And
interesting.
you'll hear your most famous actors talking about, oh my gosh, when I did that role, it was so therapeutic for me. I learned all these things about myself. Denzel Washington talked about that quite a bit in doing Fences and how he grew throughout that process, doing it over and over, always learning something every single time.
Well, this has been a really rich and moving conversation. And I want to thank you both for sharing not only your expertise, but your experiences. And, what stands out really is that healing doesn't always begin with the answers. It often begins with expression, with imagination, with helping people get out of themselves, with the courage to tell a story, skip into another perspective, which I think is what's so wonderful that you did with the acting with the children. I hope today's conversation has opened the door to thinking differently about creativity, empathy, and its connection with mental health, because I think it's really important. Thank you both for being here, and thank you to our listeners for joining in this initial episode of Doctors in Dialogue, put on by the Group for the Advancement of Psychiatry.
Thank you, Carol.